Hey guys, so it is day 2 post-op. Feeling a little bit better today. Still a little bit congested. Not too much change from yesterday really. But as you can see, I have very slight bruising just under my eyes. Not much at all actually. I'm quite surprised. They say day 2 and day 3 is the worst for bruising, but I think most of it just looks like dark circles because I suffer from them anyway. What I missed out yesterday by video, after I did record it, I got several phone calls from all the members of the team, which was really nice of them, really sweet. Got a phone call from the nurse who was there. She just asked me if I was okay, how I was feeling, whether I was taking all my medication. I did explain my concerns with the more leakage from one nostril, as she just said that it was okay, it was quite normal, just to clean around the area from tomorrow as in today. That was really nice for her to check up on me. I also got a phone call from the anaesthetist's secretary, as she just wanted to see how I was doing, as she just asked me whether I felt sick at all after the sedation or whether I felt any of the symptoms, and I said no, I felt fine, and whether I would recommend it or not to future patients, and I said absolutely, I would recommend it any day for general anaesthetic. It was perfect for me, great recovery, just feels like you were asleep. So that was nice. I also got a phone call from Dr. De Silva as well himself, just asking me how I was and just in general if I had any concerns. So really nice of them to check upon me, really shows that they all care. I think I'm not in any pain at all, but the stitches are sort of stinging a little bit, maybe because they're holding obviously the skin together, which is probably normal, but no pain at all. I did have quite a bit of bruising yesterday on top of here, but it's really gone down, and just a little bit down here. I think I'll wait for tomorrow to see whether it gets any more bruised up at all. Well, not much else. I've been sleeping on this travel pillow, which is quite good when I'm sleeping, so it prevents me from moving my head side to side, and I'm quite used to rolling over. They've recommended not to roll over to your sides and not to sleep completely head down. This is because obviously the nose is still recovering. You don't want the blood to go back or anything. So this has been really good. I think I had a better night's sleep yesterday. Still had to get up a few times. I only took one painkiller this morning, just a paracetamol, because I felt a bit congested and a bit of a headache, but nothing too strong. Another thing that I would recommend is some like facial wipes. You can't really wash your face or get the cast wet because it would fall into pieces, and it keeps the new nose in shape. So I've been using facial wipes. My skin still feels horrible, but it's okay. It's only for a couple of days anyway. Also my lips have been getting really dry because I've been breathing through my mouth, so to use a lot of Vaseline is a good idea. I've noticed that when I'm asleep I do wake up because I realise I'm starting to breathe through my nose. I think that's quite normal, that at least I can breathe through my nose, but I'd like to not force it too much yet. I would like to stick to mouth breathing as much as I can. I also managed to have a bath today as recommended. I didn't have one yesterday. I know it sounds a bit horrible, but I was only day 1 post-op and quite weak, and they say they recommend it after the first day or so. So I felt a lot more fresh, and been having naps throughout the day, which has helped me. I do have quite a lot of dry blood in this nostril, maybe because this nostril was bleeding more than this one anyway. I'm finding it quite difficult to take off the blood with the hydrogen peroxide. It was 6% that was recommended, but that's because I think it's just I've left it there for a bit long, so I've been cleaning it every day, twice a day, so that's helping a little bit. I think I can use the nasal spray from tomorrow, which I can't wait to use because I'm congested and I just want to breathe a bit more properly. I've been taking my medication as advised. Also the steroids. I explained my concerns to the nurse herself because I was a bit worried about taking steroids. I've never really taken much of steroids or medication in the past, but she said Dr. De Silva likes every patient to have these to reduce the swelling and achieve optimum recovery, so that was fine. I'm still taking the reducing one each day, and it is helping. I mean, as you can see, I've not got that much swelling in the nose, just the tip is slightly swollen, but nothing significant at all. And yeah, I've been eating a bit more today as well. Yesterday I just stuck to soups because every time I was chewing it was hurting my nose, but I've been eating chips today which is nice, and still like healthy soups. I've been making a lot of shakes. I think the only thing I would still recommend is for future patients not to keep standing up and bending down, because I think that increases the bleeding a little bit. The more rest you have, the better. And yeah, I've just been watching really boring TV all day and I am walking around every couple of hours because sitting and sleeping all day can be a bit frustrating. And that's about it. My nose itself, I can see that the bump is gone. The tip is a bit swollen anyway, but that will heal within time and get better within time. And yeah, I will, not much else, not much of a change. I will update you all again tomorrow. I think after tomorrow it will show the true size of the bruising under my eyes. There probably won't be any more, which I'm really happy about. So yeah, I'll update you all tomorrow. Bye.